CDC. Delighted to be joined this afternoon by Governor Mills, as well as Commissioner Lambrou from Maine DHHS. Governor, I know that you have to leave at 3 p.m. today. So without any further ado, again, thank you all for joining. And Governor Mills, I would love to turn things over to you.
Thank you, Dr. Shah. And good afternoon, everyone. Today, Maine reported 235 new cases of COVID-19. Yesterday, on Wednesday, we reported 217 new cases. And the day before that, on Tuesday, we reported 361 new cases from over the weekend. Over the last month, our case counts have been steadily increasing. So like much of the country, this increase is driven by the highly transmissible and more dangerous Delta variant. The people most at risk of contracting COVID and suffering serious illness or even death are those who have not been vaccinated. Vaccinations are still the best tool we have to curb this pandemic and protect the lives and livelihoods of Maine people. According to a mandated survey of healthcare settings by the Department of Health and Human Services, 80.3% of staff at hospitals and 73% of staff at nursing facilities and 68.2% of staff at intermediate care facilities for individuals with intellectual disabilities have all been fully vaccinated against COVID-19. That's 80% of hospitals, 73% of nursing homes. That's pretty good progress, but we can and must do better. Healthcare workers among us perform a critical role in protecting the health of Maine people, and it is simply imperative that they take every precaution against this dangerous virus, not simply for themselves, their own health and their families, but for the patients they serve and protect. Given the threat of the highly transmissible Delta variant to the health of Maine people, today I'm announcing that the state of Maine will require healthcare workers across the state to be vaccinated against COVID-19. The Maine Department of Health and Human Services and the Maine Center for Disease Control and Prevention are utilizing authority under existing law to issue an emergency rule that requires healthcare workers, all of them, to be fully vaccinated by October 1st. That's only a few weeks away. It's an aggressive but achievable time frame for anyone who has not been vaccinated yet to still get their first and second dose of COVID-19 vaccine, plus the two-week wait period. Healthcare workers have long been required to receive certain immunizations, including vaccines to prevent measles, mumps, rubella, chickenpox, hepatitis B, and influenza. Today's change simply adds COVID vaccine to the list of those they already must receive. The healthcare workers subject to this requirement include any individual employed by a hospital, by a multi-level healthcare facility, by a home health agency, by a nursing facility, a residential care facility, and any intermediate care facility for individuals with intellectual disabilities. All those entities are licensed by the state of Maine. The rule also includes EMS employees and those who work in dental practices. The Maine Hospital Association, the Maine Medical Association, Maine Primary Care Association, and Maine Health Care Association, the nursing home advocacy group, along with the state's two largest health systems, Maine Health and Northern Light Health, are all supportive of this step. With this requirement, we're protecting healthcare workers, we're protecting their patients, including our most vulnerable people, and we're protecting our healthcare capacity. I continue to strongly urge all Maine people to get vaccinated because doing so may save your life, the life of a family member, the life of a friend, or the life of a child who's not yet eligible for vaccine. Earlier this week, I was pleased to announce that Maine has achieved another vaccination milestone, with 80% of all adults age 18 and over having received at least one dose of COVID-19 vaccine. It's a pretty good statistic. The vast majority of Maine people have been willing to roll up their sleeves and get their shot and potentially save not only their lives, but the lives of others. As a result, Maine has maintained among the lowest rates of COVID-19 cases, lowest rates of hospitalization, and lowest number of deaths in the country to date. But with the more contagious and dangerous Delta variant spreading across Maine and across the nation, it is crucial that we continue to make progress in this fight against the pandemic. We can do this. The COVID vaccine is free and available widely. Please get your shot today. For information on getting a vaccine, just visit maine.gov/COVID-19/vaccines or call the community vaccination line at 1-888-445-4111. 888-445-4111. It's quick and easy and easily accessible all across our state. I'm happy to take a few questions from the media before I have to step out at another meeting at 3. And Dr. Shah and Commissioner Lambrew will continue to be available should there continue to be questions. Thank you, Dr. Shah.
Great. Thank you very much, Governor Mills. We'll turn to our colleagues in the media. First question for the afternoon goes to Kevin Miller.
Great. Thank you very much. Hi, Governor. Hi, Dr. Shah. Hi, Commissioner. I guess first question for you, Governor Mills. This will be unpopular and controversial with some in healthcare, some healthcare workers. Even during the expansion to the flu vaccine mandate last year, there were some folks who testified that this might prompt them to leave the workforce. Given the workforce shortages that we have in the state, especially in healthcare, do you have any concerns about that? And is there anything that can be done to try to stop that from happening?
Sure. Good question. And it's something we've been thinking about and talking about for a little bit. And frankly, one of the reasons, a good reason to have such a universal requirement for all licensees is that very problem of people at least threatening to leave the workforce and get a job elsewhere. Quite frankly, if everybody does this and we're requiring all licensees to do it, there won't be many places to go. People will not be able to quit their job and go to another job as readily because all healthcare licensees are going to be required to have everybody vaccinated, to make sure every employee is vaccinated. So the universality of this rule, I think, is beneficial from that point of view. It'll help employers and healthcare providers, and I think it will help make sure that we have the highest quality healthcare in the state of Maine.
Thank you, Governor. And Dr. Shah, obviously this is happening at a time of, as the governor pointed out, rising case rates and hospitalizations. The hospitalizations in particular have gone up fairly significantly in the past week. How concerned are you about that? And can you put this announcement into that context?
Certainly, Kevin. Let's start with the numbers. As of this morning, we now have 67 individuals who are hospitalized in Maine with COVID-19. 30 of them are in critical care. 15 are on a ventilator. As you noted, Kevin, that's an increase from where we were just a few days ago, let alone a few weeks ago. That increase is certainly not the only reason, but at least an important contextual reason why today's announcement from Governor Mills is important. We're doing this for 3 levels of reasons. The first, of course, is to protect healthcare workers themselves. They're on the front lines out there every single day. We want to make sure that when they come to work, they're safe. Secondly, to make sure that those who are seeking healthcare themselves aren't at risk for potentially getting COVID. And then, of course, the third is to keep the healthcare system as a whole intact as we experience more hospitalizations. All of those things are related. And as we are now seeing an increase in hospitalizations driven in large measure by the Delta variant affecting those who are unvaccinated, keeping our healthcare workforce safe, force protection, as it were, is more important than ever.
Thank you.
Thanks, Kevin. Let me go to Lauren from WGME next.
Hi, thank you. Yes, this question is for Dr. Shah. And Dr. Shah, we're seeing claims that natural infection creates long-lasting, durable immunity against COVID. Is this true?
It can be. Natural infection, whereby you get infected by the COVID-19 virus and survive, can lead the body to have long-lasting immunity. The question is, which would you rather have? Which would you rather go through? Would you rather have to survive COVID and go through that in order to generate that immunity? Or would you rather get a free, easy to access, safe, and effective vaccine that gets you there that much more quickly without having to suffer, and for some people can be an agonizing bout with COVID. The other thing that we note are two other quick things to note. The first is the available data to date suggests that the duration of immunity, the durability of the immunity that you get from a vaccine is far better than what you get from the natural infection. Finally, just a couple of days ago, Friday, the US CDC published a study based on data that they've been collecting from Kentucky, noting that individuals who had gotten COVID and recovered naturally without a vaccine were more than twice as likely to get reinfected than individuals who had just gotten the COVID shot. So you can train your body's own immune system to fight COVID by getting COVID, but you're more than twice as likely to get COVID again as compared to getting the shot.
There are also the long-term after effects of getting COVID. Many people have suffered long-term after effects to their heart conditions, to their overall health, to even their memory and whatnot. That's what we've been concerned about too.
Exactly. 1 in 4 to 1 in 5 people are suffering these long-term symptoms, all of which can be avoided by getting the vaccine. Let me go next to Brian Sullivan from WABI.
Yes, thank you, Dr. Shah. I wonder how this will be policed and what happens if a hospital or a health organization is in non-compliance.
Sure. Maybe I'll answer that one. So we do have a 2-decade-old regulation that we will be amending to add in COVID-19 as one of the battery of vaccinations that healthcare workers get. We are also adding, at their request, dental practices as well as EMS. That longstanding set of policies is basically has been complied with by our healthcare organizations. As a reminder, all the major associations of our healthcare providers in Maine support this move. So we expect them to be partners with us in implementing this. It is embedded in our licensure policy, so we do have recourse if needed. But again, this is not new to the facility, to most of the facilities to whom this is applying. This is just yet another important addition to the types of vaccinations that healthcare workers get.
And how will the information be gathered? It'll be self-reporting of numbers of employees that are vaccinated?
As the underlying policy requires, every year our healthcare facilities do report to Maine CDC using a form on the vaccination of their healthcare workers. So we're using the same system that has been used for years.
Okay, thank you.
Great. Thanks, Brian. Let me go to Emily from the Sun Journal next.
Hi, good afternoon, everyone. I'm wondering if the CDC tracks instances of patient to staff or staff to patient COVID infections. And if so, besides, outbreaks like we saw at Maine Med and in Belfast, are those tracked, and who sees that information, I guess?
Sure. Thanks, Emily. I'll check with our epidemiology team to see what the latest is. We endeavor to try to determine where every single individual who's gotten COVID-19 in Maine got their infection from. That is the essential purpose of doing a case investigation. Sometimes we're able to nail it down because the timeline matches, and your spouse was sick on Monday and then you started feeling symptomatic on Thursday. We can draw a pretty straight line by excluding other exposures. But in a crowded healthcare setting, with patients coming and going, with providers and patients both seeing many different people throughout the course of their visit, it can be difficult to say with certainty what the direction of transmission was or whether person A necessarily gave it to person B. We always endeavor to try to get to the bottom of that. Again, that is the purpose of doing a case investigation. But because of how quickly COVID can spread, and in a healthcare setting, just the sheer number of interactions that patients and providers can have over a given shift, let alone over a given week, it can be difficult to nail that down.
Okay, thank you. And I'm also wondering, besides the healthcare associations and Northern Light and Maine Health, how has the state, or did the state, communicate with individual hospitals or other healthcare systems before this announcement? And if so, did you get any feedback?
I can start. Commissioner, go ahead.
Yeah, the answer is yes. We work with all of our major healthcare providers in Maine on COVID-19 response and vaccination efforts. We've had these discussions over the weeks and months. And again, we welcome the leadership that some of the facilities have shown in implementing this on their own. But this point of parity is important. We want to make sure that, again, all the facilities across the different types of, healthcare settings are doing the same types of levels of vaccination.
Okay, thanks. And one last question. There's been a lot of talk since the state implement or followed the US CDC's recommendation that people mask up in high infection areas. And ever since then, there's been a lot of confusion. You yourself, Dr. Shah, have mentioned that it can be very confusing. Is the CDC considering switching to a new mode of communication about where cases are rising?
Well, Emily, you're right. Early on, when that recommendation from the CDC came out, case numbers were lower than they were now. And many of the counties in Maine were on the cusp, 49, 50, 51 cases per 100,000 in the last 7 days. And you did have a couple of days where a county was on the list and then off the list. What we've seen since then, it was just such a short time ago, is that the trajectory, the trend has not been our friend because it's been almost uniformly going up. As of today, 13 out of the 16 counties in Maine are on the list where we recommend you wear a mask in indoor public settings. Sadly, that trajectory, even for those remaining 3, is going in a direction where they too may be on the list soon. Now, we're taking a look at that list to see if it's fluctuating back and forth as it was 2 weeks ago. But generally speaking, what we've seen is counties being added and staying there. So at this time, we're not considering introducing yet a new metric, but rather asking folks to rely upon what the CDC has. We're going to keep keeping tabs on it. And if that changes, and we see those fluctuations come back, then we'll take a look. But at this time, we're not changing that approach.
Okay, thank you, everyone.
Thanks, Emily. Chris Costa, over to you next.
Hi, Governor. Hi, Dr. Shah. Hi, Commissioner Lambrew. My first question for you guys has to do with exemptions. Will the state be allowing any medical or religious exemptions for employees to regarding the COVID-19 vaccine?
Chris, under this rule, the only exemptions that are allowed are for medical reasons.
And can you explain why that's the case?
Well, I'll go back to what I mentioned earlier. It has to do everything. Well, first of all, let me say that is the structure of the existing rule onto which the COVID-19 vaccine is being added. The existing vaccines, be it for measles, mumps, rubella, chickenpox, hepatitis, that structure did not unto itself have exemptions for religious or philosophical reasons. So at baseline, we're starting with that framework that did not contain those exemptions. To add those exemptions would be a change, not a change we wanted to make, given how important keeping our healthcare workforce safe is, as well as keeping hospitals safe for patients. We didn't want to deviate from the baseline, which is not to have those exemptions.
Understood. And then if you could help clarify, and pardon my ignorance on this point, are school nurses included on this list of healthcare workers?
Commissioner, I'll let you take this one. I believe the answer is no, but Commissioner?
Unless they do work for a healthcare facility, when they are in that facility as an employee, they must be vaccinated, but schools themselves are not subject to this requirement.
So then just a last point of clarification, was there any discussion about putting this requirement onto any healthcare professional who's licensed by the Department of Professional and Financial Regulation?
Yep. Commissioner, I'll let you take this one. Yep.
Yeah, look, I think we are trying to both build on what has worked in Maine as well as be targeted in what we're doing here. We have, again, decades-old requirements for healthcare facilities and these different types of organizations to have a battery of vaccinations for their workers. We're staying within that framework and adding COVID-19 that makes the most sense at this time. We encourage all healthcare providers, irrespective of their setting, like school nurses, like those who practice on their own, to get vaccinated as well. We're just using the tools that we have at our disposal to quickly and effectively, and I will say, amongst the most aggressive states in the nation in this regard, get our healthcare workers vaccinated.
Thank you, everyone.
Thanks a lot, Chris. Let me go to Amy Brown next.
Thank you, Dr. Shah, Commissioner Lambrou, Governor Mills. Some people who have fears about the vaccines point to the fact that some percentage of healthcare workers are also resistant as validation for their fears, because presumably healthcare workers are experts. But I just wanted to be clear that when we're talking about percentage of healthcare workers that are vaccinated and what you're talking about with this new rule, you're talking about everyone who works in a healthcare setting, correct? Whether they're working in an office or any kind of role within that facility, not just medically trained staff?
I want to make sure. So, Amy, right now, on its face, the rule applies to what we refer to in the rule and what the baseline rule, the background rule, already applied to, which are designated healthcare facilities, be that a hospital, a nursing home, as the governor mentioned, an intermediate care facility. That is the background rule onto which this new requirement for COVID-19 vaccination has been applied. I hear the broader point you're making, which is what should we think about, or how should we think about and say to that fraction of healthcare providers themselves who have been resistant? Now, let's start with the baseline. According to the American Medical Association and their statistics and figures, about 90% of physicians in the United States have been vaccinated. To me, that's an overwhelmingly positive figure. It tells me that the people that we trust with our own healthcare believe this vaccine to be a good thing. I know that that's not 100%, but that's about as close to unanimity on an issue as you find these days.
Right. So I guess to be more clear, what I meant was looking at 73% of staff vaccination rate in nursing homes or 80% in hospitals. That's 80% of everyone who works in the building, correct?
I see. Yes. The answer is yes.
Okay. And thank you. And I had a couple of questions about booster shots I'm getting from listeners. One was whether or not people who receive the J&J vaccine will be given the opportunity to get a booster. And also regarding many of the articles about who would benefit from a booster, mentioned the use of corticosteroid medications as one of the factors that put people into that immunocompromised category. But there are so many people who use low-level, like inhalers for asthma, that have corticosteroids. So would all of those people be considered immunocompromised, or only people who are taking oral steroids?
Sure. Right now, Amy, thankfully, the data around the effectiveness of all three of the vaccines, even against the Delta variant, remains very good and very encouraging. Even the J&J vaccine, which has been a source of concern for many folks, but over the weekend, a research group in South Africa published preliminary findings on the effectiveness of the J&J vaccine in healthcare workers, even against the Delta variant, and found that it continues to hold up well. Tomorrow, the U.S. CDC's advisory committee will be meeting to discuss the need for boosters in certain categories of patients, namely those who are immune compromised. This includes folks who have had a solid organ transplant, groups of that nature. There may be a category included in that for folks who have been on long-term high-dose steroids. I'm waiting to see what that advisory committee ultimately decides. But it's unlikely that folks who are on low-dose occasional steroids would meet the definition for immune compromised. We'll see what the committee decides and debates tomorrow, though.
Great. Thank you.
Thanks, Amy. Phil, over to you.
Thank you. Good afternoon. First question for the governor, and then I have one for the commissioner and Dr. Shah. Governor Mills, with this order, you're obviously covering one profession. Are you considering, do you have the authority to consider or order other professions that are so very public facing as well? And the two that I'm thinking of, you've got EMS, paramedics. What about police and firefighters across the state of Maine in terms of this kind of an order? And also, schools are supposed to open in 4 weeks, and mask mandates are coming back to help that happen 5 days a week. What about teachers who were some time ago at the front of the line? Would you
Slow down, Phil. I got the question, and I have to leave in about 2 minutes, but I got the question. Today we're dealing with healthcare workers because we place our most vulnerable people in these healthcare settings, and they are our prime priority. Our first priority is to protect the life and health and welfare of our citizens. And if you or your loved one is required to access care, whether you're going to the dentist, whether you're going to a nursing home or putting a loved one in a nursing home for a short period of time or a long period of time, or a residential care facility, or the emergency room or the operating room of a major hospital, you and your family have a right to expect that everybody who cares for you in that institution, in that facility, is fully vaccinated, not only against mumps and measles, and influenza and chickenpox, but against this deadly virus. And that's what we're focused on today, protecting the health and welfare and lives of people who, through no fault of their own, are in our care, in healthcare facilities and healthcare settings. That's the issue we're dealing with today. The other settings, the other professions you're asking about are for another day. And I have to go, and I'm very sorry to miss the remaining questions, but thank you very much. I'll leave it to Commissioner Lambrou and Dr. Shah.
Very good. Thank you, Governor.
I hope that question didn't make you leave. No, seriously, the one question I had for you, Dr. Shah and Commissioner, was, as you know, the American Academy of Pediatrics this week urged the FDA to speed up its pending approval, presumably, for 5-year-old to 11-year-olds to be added to the eligibility list. Will you two, as public health officials, lend your voice to that call, or have you already behind the scenes, as you often do in this virus pandemic?
I can go ahead and start. And Phil, the professional society, the professional organization of people in my position, this professional group of state health directors, state health officials, we have urged the FDA to be expeditious in their approval for granting full authorization, if they do so, of the Pfizer vaccine, but simultaneously urge them not to cut any corners. The goal of this is ultimately to instill confidence in the vaccine. For some people, having that full approval is what they're waiting for. But if those people believe or detect that in achieving that goal, the FDA has cut any corners for whatever degrees of pressure, that ultimate goal will be undermined. So we've urged the FDA to be expeditious, but not cut corners. My understanding is that's the pathway that they're on.
Is December still the expected timetable on that for the younger kids, or is it mid-September now, if anybody knows?
I would refer you to the FDA. I'm not sure where they are. They're on their timetable. I know that they are collecting data. I know that they're analyzing the data. The last time I was briefed upon this, it was around about a week ago, exactly a week ago. And I know that they're very much in the process, but in terms of what their expected timelines are, I can't speak for them, as you know.
Thank you.
Thanks, Phil. Caitlin, over to you at the BDN.
Hey, everybody. Hope everyone's staying cool on this hot day. I've got two questions I think could probably be fielded to both of you. I'm looking at the rules, and it mentions that the final dose must be obtained by September 17th. So I'm assuming the October 1st date is meant to kind of give people time to be fully vaccinated, right? That's kind of the idea there.
Correct, Caitlin. Yep. It's okay. 2 weeks. So essentially, you got 2 weeks after your second dose, which means on October 1st, you can report to work fully vaccinated.
Okay. And my second question is, I'm wondering if the state is going to do anything like offer any like specific clinics, or are we just expecting like healthcare workers to kind of go out and get vaccinated themselves? Are we hoping like their employers will take that up?
I think it's a mixture there, Caitlin. Certainly, if there is a healthcare facility or a group of healthcare providers that needs an extra hand in holding a large clinic, we can help that. We have teams of different groups, be it public health nurses or others, that are standing by to assist in that. We haven't heard in the discussions that Commissioner Lambrou and I have had with various folks in the stakeholder community. We haven't heard that request, but if it does come our way, we're still working with groups to offer pop-up clinics where they might be needed. We did one just a couple of days ago in Lewiston. So we've got that capacity, we've got that capability. At the same time, healthcare providers themselves are often the ones that are doing those pop-up clinics. So my hunch is that they've got that capacity, but if they need a hand, we are here to help.
Thank you. And I guess my final question is, Dr. Shah, you mentioned, I think it was last week, that the state may reconsider its masking recommendation process because, the CDC numbers change so rapidly on the federal level. And I'm wondering if you might have an update for us on that.
Yep. Caitlin, the recommendation stays intact. That part we're not considering changing. It's essentially which counties and the frequency by which those counties might be updated. When those first came out and we first started going down that pathway, you saw, and you've written about this, we saw a little bit of whipsawing, kind of back, York was on one day and then off the next day. And that happened a few instances. But since then, Caitlin, the trend has been unfortunately uniformly in one direction, which is toward counties being added and not really falling off in regular fashion. It's happened, but it hasn't happened in such with regularity so as to sow more and more confusion. So at this time, we're not planning on putting out an alternative list of counties with more steady and regular updates rather than the daily. We're keeping an eye on it. If it changes and we get back to that whipsawing, then it's something we can bring back out. But I think what happened was that early on, there were just a high concentration of counties in Maine that were at the 47, 48, 49, 50, 51 mark. And that's what was causing them to go up and above and below the line.
Okay, so it sounds like what you're saying there is that, unfortunately, community transmission is going in the wrong way, where you think that confusion about the day-to-day changes is going away.
Unfortunately, yes, the problem has been ameliorated, but not in a way that we would have liked.
Thank you.
Yep. Oh, I think, Commissioner, did I cut you off? Okay, sorry. Thank you. Thanks, Caitlin. And the final question for the afternoon goes to Patty White.
Thanks, Dr. Shah and Commissioner Lambrou. Can you just give us an update on the outbreak investigations you have at hospitals and long-term care facilities? Is it still, 2 at hospitals and 2 at long-term care facilities, and have the numbers changed?
We'll get you the latest numbers, Patty. They were updated just a little while ago, and I'll make sure we get those over to you. But the investigations are ongoing. And as with many healthcare facility outbreaks, trying to do a couple of things. First, try to have a sense of what may have caused the introduction of the virus. Secondly, whether there are additional steps that we can take to prevent further transmission. And then third, make sure that healthcare workers are safe. On the latter two, making sure that there isn't an increase in case growth, that's what we've actually seen at most of these. And that's largely a function of how quickly the hospitals have reacted. And I really commend our colleagues at Waldo County as well as at Maine Medical Center for jumping on these. They conducted testing in what's called a ring strategy, testing sequential groups of people until you don't find any more positives, so as to be sure you've captured anyone. And then, of course, with those you do find, making sure that they're isolated and not infecting others. As a result of that quick strategy, we haven't seen explosive growth from any of these outbreaks. We have seen cases, but they haven't generated ongoing transmission. And that is, of course, the goal of an outbreak investigation, which is to try to tamp down on that ongoing transmission.
And are most of the cases involving staff, are the staff members unvaccinated?
It varies. So at the outbreak involving Maine Medical Center, the bulk of the staff were in fact vaccinated. And as of yesterday, Patty, and I want to make sure these numbers may have changed as to Waldo, and I'll check to see if they have today. But as of yesterday, the bulk of the cases associated with Waldo County among employees were among unvaccinated folks. But Patty, I want to check that to make sure that information is in fact accurate and up to date. That data that I mentioned for Waldo is as of yesterday, and we'll check with the outbreak investigator and get the latest as to today.
Thank you. If I could ask one more quick question, it's about travel, just because people have made travel plans for the fall and for holidays. And I'm hearing people wondering, whether that's going to be a good idea. With what you know now and what you're seeing, do you think there are going to be recommendations to, avoid gatherings in the fall?
Patty, I'm going to say those 3 words that are so hard to say, but they really capture where I'm at right now. I don't know. I mean, it's definitely safe to say that the Delta variant has thrown the biggest wrench possible into our summer plans. What that means for the fall, I don't know the answer. There are some models that are out there that suggest that the Delta variant may follow a path as was seen in India and the UK, which could lead to a reduction in cases on the sooner side. But there's a group that the US CDC works with out of UNC's public health school that also put out some models not long ago suggesting a slightly longer duration, to say nothing, Patty, of other Greek letters out there like lambda. So the honest and truthful answer from me right now is I don't know what the fall is going to look like from a travel perspective. If it makes anyone feel like they're not alone, my family and I were having this exact discussion over the weekend about Thanksgiving and Christmas and what we should be doing about that. So I'm really not sure.
Okay, thank you.
So, and thank you all. Commissioner, anything final from you for the afternoon?
Just a quick note, thanks, because our announcement today about the vaccination, adding COVID-19 to the array of vaccines that healthcare workers get, was made possible by the leadership of individual hospitals and facilities, the associations, and a Maine public that continues to support vaccination as a way out of this pandemic. We have a lot of work to do, but I think we are rising to the challenge, and we're confident that by October, we really will have safer healthcare facilities in Maine. Thank you.
Thanks, Commissioner. And thanks to all of our colleagues in the media for hopping on and joining us today. Thanks to all of you who have tuned in this afternoon. We hope you have a great and relatively cool afternoon. Stay cool. It is soupy out there. So I hope everyone does okay and stays cool. We look forward to chatting with everyone soon. Take care.